Greetings, my name is Sadia Tahir, and I will be presenting our project, Hypertension Education and Management in Barbershops in Toledo, Ohio. Co-authors include myself, Lena, Faisel, Chanell, Upshaw, and Dr. Camelia, Arsene, and we are from the University of Toledo College of Medicine and Life Sciences. Here is an overview of our poster, and I will be going into specific detail now. Disparities in healthcare, barriers to accessing quality healthcare, and varying attitudes towards healthcare contribute to the poor health outcomes of marginalized populations, especially African American and Black men. Life expectancy of African American men is by far the lowest across gender and race. Historically, African Americans have undergone covert and overt experimentation and have been undertreated or discriminated against when receiving care. As a result of these previous significant events, many African Americans approach attempts to improve their health care with skepticism and suspicion. This perspective is why researchers across the nation have decided to bring healthcare directly to African American men, using barbershops as the prime place. The goal of this study, with hypertension education and management at its forefront, is to train barbers on how to measure blood pressure using automatic blood pressure cuffs. The aim is to improve barbers as well as their clients' knowledge and management of hypertension and lower the blood pressure readings of clients through health promotion. The methods of this study include an intervention study with pre- and post-intervention surveys. A total of 6 barbershops and 19 barbers are participating in the Toledo area. Every booth in each barbershop was equipped with an automatic blood pressure cuff, as well as business cards to write down each client's blood pressure. Medical students were trained on the A, B, C, D, and E of hypertension and use of blood pressure cuff so that they can train the barbers. This figure is a representation of the different factors that we use to teach education of hypertension and how they relate to each other. A is for awareness, gaining a sense of what hypertension is all about. B is for blood pressure readings and how to use the automatic cuff. C is for cigarette smoking and cholesterol and how they negatively impact hypertension. D is for diet, and E is for exercise. This table shows the hypertension knowledge survey that is administered to the barbers before and after the intervention. There are 10 items in this survey, and demographic information of the barbers was collected beforehand. In summary, health promotion and engagement of African American and Black men using present community infrastructures proves to be a promising way to reach this specific population and improve their health outcomes. Medical students engaging with barbers and their clients fosters an environment of trust and learning. The overwhelming support and trust of the barbers from these barbershops is key to developing trust with their clients. Projects such as this one in barbershops can help identify asymptomatic hypertension and promote education and management of this chronic illness before the development of comorbidities. The goal of this endeavor is for barbers to provide a blood pressure with every haircut and to provide education and strategies for the management of hypertension using long-established trusted relationships. The next steps for the project include continuation of the involvement of medical students in the barbershops and surveying the barbers after 12 months. The authors would like to recognize Robin Charney, Community Liaison at ProMedica, whose heart and soul has been this barbershop initiative long before medical students were involved. And we would also like to recognize ProMedica for their generous support. Thank you so much.